have the partners on board. And this will give an opportunity to the members of the community of practice to be more familiarized with the partners' sphere of activities, and also the partners to know the various members of the community of practice, so that there's greater synergy in the times to come. So I think we can just start by formally welcoming, and I'll just give a brief intro about Dr. Gaduri, and then we will just start. Dr. Bani, you can just handle the people who are in the waiting rooms, so that I will be concentrating on that part, introducing Dr. Gaduri. Okay, so I have the pleasure of welcoming Dr. Vikram Gaduri. Dr. Vikram Gaduri is the Scientific Affairs and Educational Leader, Asia Region Healthcare Business Group 3M. Dr. Gaduri has got a rich experience of 15 years in areas of wound care, infection prevention, quality improvement, and infection control in hospital settings. He's got extensive experience in developing training modules, supervision, and implementation of the capacity building initiatives, and has been actively involved in developing scientific marketing initiatives. Dr. Gaduri has initiated the point surveillance audit program for medical adhesive related skin injury and incontinence associated dermatitis in India. Well, I should say, Dr. Gaduri, that these are two very important issues which are directly related to quality improvement and improvement in quality of care. And I'm sure our group will be sensitized by your rich knowledge across these relatively new areas to our group, and we would try and see if use of point of care quality improvement methodology can help our teams to address these two very commonly encountered issues in the pediatric and the maternal health compendium. Now, Dr. Gaduri has also been the lead partner to the NABH and Consortium of Accredited Hospitals, CAHO, on education towards skin and wound care and chronic wound care infection prevention. He lectured in more than 300 national and international seminars and conferences, and he has one design patent on new skin-friendly adhesive platform for securing devices. Dr. Gaduri, besides extensive publications, has a main publication on use of barrier films, that is 3M Cavalon and no sting barrier films to reduce local skin complications around PICC lines in WCET Journal USA, and has contributed and supported 15 white papers, and also to the Advanced Manual on Sterilization Assurance, which is endorsed by another one of our partners, that is CAHO. Well, CAHO, as all of you know, is a partner to the communities of practice. And in one of the subsequent sessions, we'll also have the whole team from CAHO speaking up with our members. Dr. Gaduri has also worked on quality improvement initiatives, and we are very happy to learn that, sir. And he has contributed to development of infusion nursing standards for India in 2014. So I think there are lots of nurses here, Dr. Gaduri. They would be very happy to learn from your experience. And he's a certified trainer by JCI on perioperative processes. And he's developed toolkit on surveillance and monitoring of healthcare associated infections, and worked in the core group to adapt IMAI and IMCI publications. I think IMCI is something which is very close to our heart. Dr. Rajesh Mehta here and our group at Kalavati Saran Children's Hospital also jointly worked on IMNCI and adapted the IMNCI to the neonatal component. So this is a common area, Dr. Gaduri, which we share with you. So, sir, I have the pleasure and the privilege of inviting you. The screen is all yours, sir. We will have Dr. Vikram Gaduri address. And then at the end of it, I request all the participants to please keep their mics on mute. Raise your hands. At the end, we'll have a question and answer session with Dr. Vikram Gaduri. And one by one, I will be facilitating the question answer session. Thank you so much. And I welcome Dr. Vikram Gaduri from 3M. Sir, the screen is all yours now.
Thank you so much, Dr. Vikram Datta. First of all, on behalf of 3M, I thank Dr. Vikram Datta, President NQOCN, and all the dignitaries who are here for giving us this opportunity to share about the company and also our journey with the patient safety and our collaborations that we have since the inception of 3M India. Without much ado, I just wanted to start with sharing some trivia about the 3M India, or 3M as such. So I'm not sure how many of you are aware or you know how 3M adhesive technology has revolutionized the 3M out medicine. Now, the first paper tape or the surgical tape that we call has been an innovation from 3M. It was during the World War II that the cloth tape had a lot of issues, and it came to the notice of 3M scientists, and they created the first surgical paper tape. And that technology over the years had transformed into the sutureless devices, which we call the steady strips. Secondly, the one small step for on the moon and one big giant leap for the mankind, but that small step on the moon surface was actually by a 3M polymer, where the 3M scientists were able to create a polymer which can withstand the conditions of the moon at that point of time. Excuse me, I'll just close this for a while. Yeah. And also 3M has received the highest award for achievement in innovation because of the various novel products and solutions that it has contributed to society. We are joined in this league by the other well-known companies like Apple, IBM, and AT&T. The other important contribution to the healthcare from 3M is the meter dose inhaler. This was actually born from a child's question on why can't they put these the medicine into a spray, and one of our scientists was able to invent the meter dose inhaler, which ended this whole process of repeated dosaging without cumbersome refilling process. So that's more of a trivia of what 3M has contributed. But largely as a company, 3M has sales in more than 200 countries. We in total about $33 billion in sale. We are now driven by 4 major businesses and a strong team of 93,000 employees worldwide. 3M, as you know, is an innovative company, and we have invested a lot, and we take pride in our R&D facilities. And India also has one R&D facility in Bangalore. And in total, 3M as a company has invested about $1.8 billion towards development of new solutions and patents. We have 100,000 patents, more than that till date. And to our, the investors, we have given more than 100 years of steady dividends. And 3M is one of those companies, 30 companies on the Dow Jones Index, Industrial Index. So that's about the accolades of 3M. And from a global realignment, till recently, we were driven by 5 businesses. But to better, make ourselves agile and competitive, 3M is now a 4 business group driven company. And healthcare is one among those 4 pillars and aimed at improving the quality and delivery of healthcare. And our vision is 3M technology advancing every company, 3M products enhancing every home, and 3M innovation improving every life. And needless to say that the healthcare, the arm of the company is able to drive through its multitude divisions, all the 3 into every company, every home, and every life. And when it comes to the 3M's involvement from a healthcare perspective into the patient safety, we have been there right from the start when this whole revolution of the patient safety has begun. 3M, if you look at the peak of into the history of patient safety, you all know it all started way early in 1982, peaked in 1999, and in between 2 years before the NPSF was formed and all. And India and 3M has been a partner to the NPSF right from the start. In fact, 3M was one of the founding members in 1997, along with the American Medical Association and CNA, to form the National Patient Safety Foundation. So our roots and our interest in the patient safety is where right from the time when the whole revolution of patient safety has begun, and we continue to promote and support with the help of organizations like NQOCN. Our collaborations till date have been many, and we take pride in these collaborations. In fact, because we want to look or see ourselves not as a vendor, but more to be recognized and seen as a solution provider. That's where our endeavor has always been, having to create value to all healthcare fraternity members, so that there is an improvement in the practice as well as the patient outcomes. And this is not a comprehensive list, but the ones that I thought are worth sharing. We have a collaboration with JCI where we developed a toolkit on the surgical safety services, and more than 20 countries have actually participated in JCI in this program. We also have partnered with SHE, and together we have driven a program called the Ambassador Program. Now, the idea of this program was more about dedicating or fostering the relationship between the US and the international healthcare, and especially from the developing world in the healthcare. Now, the idea was that, once we have these people who have interest in epidemiology or in patient safety, they get in contact with the international experts. They learn from their expertise and come back and do the needful for the country to move the needle in the patient safety. And India had a fair share of the ambassadors right from the inception. We have about 6 of the ambassadors from India that SHE has recognized from India. APSIC has been a partner for long, and we have 2 principal projects that are going with Asia Pacific Society of Infection Control based out of Singapore. And one that is very noteworthy to share is the CSSD. I will talk about this and our engagement with many organizations in CSSD in a while. But this is something that we are very proud of. Having been able to create a program at a regional level that can get the focus to the CSSD, which at this point is missing in most part of the Southeast Asia and probably in the world. ESHM likewise is the other international organization. The 3M globally has partnered with, again in the CSSD arena, where we want to promote the best practices. And again, like SHE, we also have run an ambassador program with ESHM, and it continues to be there, but it has not yet received the same kind of response as probably the SHE has received, because again, I would say the lack of the focus on this department, and we probably require support from NQOCN and similar organizations to get the desired focus to CSSD. INS India has been one of the first international affiliate of an international organization in India, and 3M has been the founding member of the INS India chapter. It's been 10 years now, and this year we were supposed to have the 10th national conference, but COVID has, like many other conferences, it has put a break on that, but nonetheless, we hope to have a very good conference next year. And launch the revised version of the guidelines that we have for infusion therapy. Along with INS, we have also driven a program called Infuse, which I'll take you through in terms of the quality improvement. Likewise, CAHO, another sister concern, and we shared that together. And together we have announced the 3M CSSD Awards to get that focus into CSSD practices in the country, and be able to drive the best practices in that arena. It's been 3 years now that association with CAHO is, and we're trying to revamp that in the current context of the COVID, but otherwise as well, to make it more robust and be able to cater to all forms of the healthcare providers in the country. Likewise, the Healthcare Sector Skill Council, we have had the association, and the association more towards, again, the patient safety by means of standardization of healthcare practices. In 2017, we signed the MOU, and we have, to start with, we are working on CSSD practices with the HSSA, but we'll expand the focus to OR and the other areas of interest. So those are the 3M collaborations that we have, and right now we have the NQOCN, and we are very happy and proud to be associated with NQOCN, and together I'm pretty sure we'll have a new leaf laid out in terms of what work we can do together from a knowledge partner and a combination with NQOCN and the sister concerns. Through our various collaborations and the educational initiatives across and with the scientific affairs function that's there, and I'm part of that, we have been able to create a lot of value and help the fraternity at the world stage, both saving and improving lives around Needless to say, you know, the 3M solutions are of course very unique, as you all know, but 3M gets those unique solutions to the fraternity through the, you know, what we call as care pathways. Now, from a definition standpoint, it might be a little different from the practicing clinicians in terms of care pathways, but we look at our solutions not as individual products, but we want to, kind of bucket them in terms of these care pathways, so that at the end of the day, they act synergistically in kind of making sure that the patient outcome is better. And so in terms of 3M care pathways, we have these 5 major ones that we focus. And I'll take an example in these 3 or 5 to share with you what programs that we have driven with our collaborations and in the country. One is the surgical safety solutions. Second is device reprocessing, which is nothing but the CSSD. We are also very actively involved in the vascular access management, and that's where you have seen our engagement with the INS. We also have, 3M is known as an adhesive company, right? And so the kind of adhesive technology that 3M has is unmatched, and thereby the securement of the critical devices, which Dr. Datta has mentioned in his talk, just now, is that is not well known, the MARSI, or the medical adhesive related skin injuries. That is still needs attention. We all, take it for granted that because tape has to be used any which ways and it will lead to some kind of injury to the skin, but that is not the case. We can avoid the MARSI as well. And that's also part of the patient safety. And I think, together we can get the attention to the MARSI and of course the incontinence-associated dermatitis as part of our skin and wound management. And so these are our typical and the most prominent care pathways that we have. And I'll take an example of most of it and try to show you what we have done till now. Before that, we also are actively involved in the healthcare worker protection. 3M has gained more attention than ever in the current circumstances of the pandemic. And we are well known for our, protection gear. At this point today, we're probably much more happier and content and very proud that we have been able to protect the caregiver himself. You guys, you all the people who are protecting the patient, we have been able to stand between you and the patient and protect you to be able to, again, make sure that you are there in the area that is required to protect the patient. We have a grand, a very large array of products to share with your solutions, depending on the setting or the anticipated hazard, depending on what kind of practice that you are looking at or what kind of setting that you are in. So I'll not go into the details of it, but I can share this information, whoever is requiring or interested to know more about this information. So that's about the healthcare worker protection. And more importantly, the infection prevention, that is very close to 3M. And since inception, we have been working towards creating solutions that can help prevent infections. And we're not only looking at, as a product, but as I said earlier, it's more about the whole gamut of the infection prevention, or looking at the all angles. And we call this as a comprehensive infection prevention approach. Wherein we are not only looking at the solution, but also people, the practice, as well as the equipment. Now, from a people standpoint, yes, it is more about reducing the cross-contamination. It's also protecting the patient or the caregiver from any kind of undue risk. Practice, yes, we through our collaborations, we have been able to influence uptake of the guidelines. Also, in terms of identifying those new areas where it might be necessary to create a consensus document. For example, the medical adhesive-related skin injuries. We have been able to create both an international and a national consensus document on the MARSI through our, various nursing key opinion leaders that were there. So through the 44 odd nursing KOLs across the country, we have been able to create that skin integrity consensus document that we'll be happy to share with NQOCN, that can be probably looked at and improvised to make sure that we get to to the wider audience and gain acceptance. And of course, the equipment and the environment, so through our sister concern divisions, not only in the healthcare, but other divisions, we have been able to provide the wide array of products or solutions that can help disinfect and make this environment and the equipment safer to use between the people or between the patients. Quickly into the details of the program where we have invested on. The first, is with the Infusion Nursing Society, India. We have launched this program called Infuse. This was launched with an objective. Now, just a step back. INS had already launched the guidelines, the first version of the guidelines in 2014. This was more of an adaptation of the Infusion Nursing Society US guidelines that we have adapted to the Indian context. But one of the critical things that we have seen is that it's not about the availability of the guidelines, right? The guidelines are aplenty. There is no need for new guidelines. What we observed is even if it is a very tertiary and a formidable hospital, but the compliance at the end user level is the concern rather than the availability of a protocol in the hospital. So the objective that we thought of creating, when we, it's not about creating a new program, which was a competency-led program. So the question in hand for us when we devised these programs was, is competency more important or the compliance more important? And when we looked at the available training programs, and also I'll share with you the Healthcare Academy portal that we have, there are a lot of competency-related programs that are available that makes the caregiver competent and get that required information to do the necessary job. But there were very handful programs that were there to really check what is the compliance towards these practices that are laid as a protocol in the hospital. And the second thing that it came to as one of the revelation was that the hospitals are more inclined towards measuring the outcome. So you have an indicator, be it patient safety or a hospital-acquired infection, you have an indicator in terms of a numeric. So you okay, I measure this and I get a numerical value of the patient outcome. Now, if that goes beyond my threshold, there is a retrospective way of looking at what went wrong in terms of the root cause analysis. We thought, let's turn the table around and say, okay, why not we look at not the numeric itself, but the practice. So we thought, let's design a program which is not related to the outcome, but through process itself. And so the objective for this program was more about standardizing and implementing the National Intravenous Policy and Procedure. That's because, to be honest, we have not found any document which was a national document that we could say that could address the infusion therapy at large. And so we wanted to standardize that document. That was number one. Second, to support the healthcare institutions and adopt the best practices to comply to the guidelines. And that's where we thought, okay, auditing and measuring the compliance is what is important rather than measuring the outcome in terms of what complications have been prevented. There have been a lot of things. NABH does this, CAHO does that. A lot of organizations do that. So we don't want to, have a program which is a mirror image of that, but rather aid towards getting that kind of recognition which NABH or any other accreditation agency wanting to look at. That's the outcome. So, and of course, when a hospital is more compliant, yes, we recognize the importance of the reward. And so yeah, we have been able to put that in place for the best adopters. The outcomes that we're measuring was more in terms of what is the patient impact, of course, in terms of related complications, what is the patient satisfaction, and how much cost we have been able to reduce in terms of repeated use of the equipment or extended length of stay of the patient and so on, from a health economic standpoint. From a clinical impact, yes, we are looking at standardized care not only between the hospitals, but we have found that there have a change in the practice in between the units of the hospital as well. So it's more about standardization of care, elevation of practices, and reducing the inefficiencies. At the same time, we have been able to utilize this platform to get the support of the key opinion leaders like all of you who are sitting here, form an advisory board of physicians, a technical committee with the INS India, and also auditing with all the important dignitaries, like all the members who are sitting here with the NQOCN.
we have been able to have those resources being given to all the hospitals enrolled one. At the same time, break it down into checklists that was easy for them to start looking at each procedure and be able to be as a ready reckoner, so that we utilize the same checklist for measuring the compliance. But when you're doing the hand holding through the 3-month project that we have, they are already aware of this checklist. So it's more of a you're telling them what you're measured on, at the same time you're measuring what's being done. And second similar program is on the OR front. We call this a Safe Surgery Program, aka the OR Excellence. It's more about the entire gamut of the perioperative care that we are trying to address. And throughout the surgical journey, our solutions are there to help you to get the patient out of the hospital as soon as possible with little complication. So we have these 3 big interventions, which is the patient preparation as a preoperative, surgical intervention during the intraoperative phase, and the patient recovery during the postoperative. So we have the program encompasses all these in different sets, and the hospital can look at taking this in different buckets or all together in one go. But we encourage the hospitals to go in as one process, so that we fix all the desired practices or fill the gaps that are there in one program. There are 4 critical steps in this program. One is assessment. Like the resource booklet from INS that we have developed a OR excellence booklet based on the CDC guidelines and international organizations directives, be APIC or EPIC and AORN. We have created a book, but then we have not yet found a partner that we could look at in India, because we have not seen an AORN kind of a body. Yes, there is one that we are working to to look at, participate in partnering with them. This organization is based out of Mumbai from Tata Institute. So the first step is assessment, wherein we define the scope and the focus. So what are the areas that needs that probably is not practiced to the way it should be, or what protocols need to be changed or updated to meet the desired criteria. Then we do the on-site review with the help of a leadership team from the hospital itself. A minimum 5-member team is required from the hospital, so that we discuss with the leadership team on an on-site review, understanding what is the compliance to these guidelines that we have agreed in the part of the assessment. And then we have this action plan where we create a roadmap for improvement depending on what comes out of the compliance data. We know that some things are being done great, some things probably are not done so much. So we try to look at 5 indicators at a given point of time and look at creating a roadmap for improvement. And then we do a PDSA of that, and then we go back and the cycle continues till the time the desired results are there. And that's part of the implementation and achieving the goals. So that's in a nutshell about the safety in the OR and the program that we call as an OR Excellence. One thing that is very close to our hearts these days, and we are really putting our efforts and mind towards, is the normothermia. Normothermia, of course, from a 3M standpoint, we are more focusing on a perioperative normothermia, and we have this program called Degrees Matter. And we are trying to create awareness about what hypothermia can lead to with all the complications that I have just enlisted here. But what really caught our attention when we were talking to NQOCN and Dr. Vikram Datta was the paper that was published in BMJ on reducing the hypothermia in newborns, which was led by Dr. Vikram Datta and et al. This was like an eye-opener for us, and then it really struck the chord. We thought, why not we, with the technology that we have, if we can join hands and be able to make this not, kind of results that Dr. Vikram Datta has received in this hospital, if we can replicate that in multitude of the other hospitals, so we can provide the required technology wherein it is more about even measuring the problem statement, and also, being able to reduce the hypothermia rates. So we have both the solutions. We have a non-invasive technology where you can accurately measure. It's non-invasive, yet very accurate in measuring the core temperature of the patient. And that actually helps you in identifying the problem much more better, because you probably will not be able to have an invasive device to measure the accurate temperature for defining the hypothermia. So this is something that we are looking forward to partner and have a program that we can run together as partners and get the required attention to this arena as well. The other project that we have is the CAHO, which with CAHO is called the Project ACE. Earlier it was the CAHO Awards, but as I said, we are rebranding this and kind of making it more robust. The A stand for the awareness, competence or compliance, and then the E is the excellence. So this certification program is more towards the CSSD part of it. As I said earlier, CSSD is not received the attention it has to receive, like OR or an ICU. But it's very true, and a lot of literature is available to showcase that, if you don't have the CSSD properly functioning, you definitely have a lot of money that is being spent otherwise. So, this paradigm that we have, shift that we need from a cost center to a revenue center for CSSD, that's what we're trying to achieve. And most of the staff these days, I will not generalize it, but then most of the staff that we've observed in a resource constrained setting, let's say, is learning on the job. There is no required competence that is checked for people who can work in the CSSD. So we're trying to look, either with HSSA or with CAHO or, maybe with ISHM or with AppSeeker international level, we are looking at creating a standardized education module for CSSDs, managers that they can take and get both national, international accreditation and certifications. So that's a part of this program. And also trying to, shift the gear from not looking at CSSD as a, because it is a cost center, we need to cut the corners and save the cost, but it's more like a revenue center. And so we need to work towards cost effectiveness. And so, the whole idea is to, equip the CSSD with those best practices at the end of the day, which will be able to get the patient safety in the OR or in areas where the sterile equipment is required, both for the patient as well as for the caregiver. One last before I end on the IIM's contribution is, we are working, KCI is one acquisition that we recently had. Most of you might be aware. And with that, our arsenal for the wound care has just multiplied. And we are at a position right now to be able to cover the entire gamut of wound care. Be it from the negative pressure wound therapy to the novel dressings, so in the foam or any other. So we are working towards creating a platform where we could have the maiden wound certification program in India. So any input or guidance on that from eminent personalities in here, that would be great, to be able to create this platform for wound in India. One last thing is about the Healthcare Academy portal that we have. And this has been in existence for about 6 years now. And I don't have the, I'm sorry, we don't, the latest numbers here, but till 2016, we had about 400,000 professionals educated through our portal. We have more than 350 courses that are through online and mobile applications. We kind of do more than 10,000 customer events and training sessions across the world. So if you are interested, to utilize this, please, feel free to contact us, and we can probably host the modules that you think can be reached out to all these people who are already engaged with us, not only at the national, international level. That will be a great asset. In India, taking that a little further, we had a lot of live webinars in the COVID arena, times in the last few months. This has been the way forward for education, however. So we had a series of webinars that we have created, and one such webinar is happening again this month on 26th of September. So we will send out the invite to all the people here from NQOCN, and just to showcase what 3M is investing on, and how we are doing our bit in making the healthcare fraternity get geared and be ready for the new normal that is going to come from. And we also are not limiting ourselves to the English versions, because we know that India is a multi-linguistic nation. And so we have been investing in translating some of the modules which are much more required into the local languages. We have started with the Hindi language. We have about 25 modules that we have completed till date. This has reached to more than 500 people have already taken this. The number of downloads are more than 600, so they might be using this offline, more numbers. So, but through our association with NQOCN, where it's working at a grassroots level, I think this will be much more meaningful and useful as well. So we request NQOCN to vet it out and help us to make it much more robust. That's it from our side on the 3M contribution of what we have done or been doing so far. With all the science that we have, and we apply to the life, three major programs or pillars that we say that are driving our programs is diverting skin, preventing complications, and restoring lives. And all these, on the right side that you're seeing are the solutions that have been able to create from our technologies when we apply it to the life. So with that, thank you so much for the opportunity. And if you have any questions.
Thank you so much, Dr. Guduri, for that excellent presentation. I think we are really enlightened. We only thought about 3M as micropore and Tegaderm, and maybe in the COVID times as some of the masks and some hand sanitizers. We of course knew that it was a great company with a lot of innovative products which were coming up. But we never knew that there were so many quality improvement initiatives which 3M has launched all across the globe. So I think with that, it's opportune that for a platform like NQOCN, which is a vibrant young network, we're really fortunate to have a partner like 3M, which is supporting us in our communities of practice platform. And we also have support as a major support, Dr. Rajesh Mehta, the regional advisor from WHO CRO. So we will start the question and answer sessions, and I will give my concluding remarks in the end. So first I will request Dr. Rajesh Mehta. Sir, if you could start with the initial comments, and then I'll take the question and answers. Everybody who has a question to please raise their hands. I would be asking you to lower your hands and unmute yourself one by one. Dr. Rajesh Mehta, sir.
Yeah. Okay, Vikram, thank you for arranging this. This is a good way to meet and greet the partners in your community of practice. So good that 3M was the first one to come about. So thank you for that presentation from 3M, Dr. Guduri. The patient's safety is an inseparable part of any healthcare quality programs. So even WHO, we have this twin stream of work. One is, of course, compliance to the clinical guidelines, but compliance to infection prevention is an essential part. And even if we did not emphasize during our introductory proceedings for key programs, the healthcare teams would identify one of this as an essential or prioritized quality issue. For example, hand washing comes very naturally for healthcare teams working in labor rooms or in neonatal units. And by prioritization, they come to this that infection is common and hand wash practices can be improved. So thank you for highlighting all that patient care streams of work, which is very important. And we'll be saving cost by preventing infection and by reducing the hospital stay. But also I observed that you have quite a bit of investment in the human factor, not just only the products or the equipment, but the practices, the compliance of the people who actually have to use your equipment and products. So NQOCN also has the similar, one of the streams of work to improve compliance, and that is their first actually focus on the quality improvement area. The second I noticed was you also health educational materials. So for example, if NQOCN tries to prepare some digital products for in-service training, or wants to translate some guidelines or even the methods or the training packages, there could be collaboration possible.
Yes, sir.
If you are, also, for example, doing normothermia as one of your streams of work, we were also considering at one stage that since hypothermia in newborns is very common, so why not have a collaborative across some states or across the whole country, that every healthcare team involved in newborn care is actually using quality improvement for hypothermia as a synchronous kind of activity, where people could improve their practices of thermal protection of the babies. So a lot of opportunities, but my question only is that how do you take care in price-sensitive markets like India that you do not promote inequity in healthcare, or is it not a consideration at all for you at corporate level?
Thank you, sir. First of all, thank you for your comments. I think, yes, there are a lot of opportunities for us, and we look forward to your blessing and ideas to work together. Now, coming to your question on the cost-sensitive markets, I will request Rajiv to come in further, but yes, sir, the two things are really discrete and separate. For us, business is not what drives the education. Education, we do more for creating an impact and, create the value for the customers and making sure that the best practices are being adopted. Now, we definitely, as I said earlier, we as a company do not want to see ourselves as a vendor. We want to be seen by our partners as a knowledge partner. But at the same time, we also believe that, once the hospitals, imbibe the best practices and the quality, obviously, it is a win-win situation for all, be it for patients, be it for the hospitals, and be it like, the partners like 3M. Because we, at the end of the day, will be able to create that value or the outcome based on the solutions that we have. It's more about the health economics and the outcome rather than the price. That's what our conversation is always about.
Thank you so much, Dr. Guduri. I would take this opportunity to welcome Sri Rajiv Gupta. Sri Rajiv Gupta is the country business leader from 3M. And I would like to use this platform to acknowledge the kind help and support which is rendered by Sri Rajiv Gupta, who has spearheaded and catalyzed this partnership between NQOCN and 3M at the national level. Welcome, sir. Any comments or any observations, sir?
Good evening, Dr. Datta, and good evening, Dr. Rajesh. Thank you for the opportunity. It's a privilege to be a partner with NQOCN. We look forward to collaborating and working to improve and obviously work towards the betterment of one is the patients and also the healthcare providers. So it's not only limited to the patients, we are also concerned about healthcare providers and their safety. So we would like to ensure that the quality improvement programs which we do are not limited to only patient safety, but also healthcare provider safety. To answer Dr. Rajesh's question on whether we are really looking at affordability in terms of healthcare processes and systems, we do keep this in mind whenever we are talking about whether we are working in the healthcare facilities or engaging with healthcare providers and patients. We do ensure that we look at cost effectiveness of our solutions. It's not about the cost of the product, but it's about the whole process. Now, what I see in India is that we do not mind spending money on providing some solution to a patient or a healthcare provider. We do spend that money, but we don't look at the effectiveness of that. So when we talk about a product, we look at the whole environment and the whole process, and then we look at where we can save money for the hospitals in terms of, one is the healthcare access, The other thing is on the improvement in the process. Most of the times, if we improve the process, the cost effectiveness just comes in because of that. Case in point would be, if I look at the CSS, or let us look at the normothermia. We use invasive way of measuring the core body temperature, which results in lot of infections. And the cost which we pay for treating the infections is much higher than the solution what we have in terms of a non-invasive core body temperature measuring. Now, yes, the initial cost seems to be a bit high, but if you look at the whole process improvement in terms of measuring and ensuring compliance to normothermia, and also in terms of reducing the infections, the overall cost benefit what the system gets is much more than the product cost itself. So it's not only about the product, but also about improving the quality of care through the process improvement also. So that's been our objective. We, like Vikram said, we do not look at ourselves as a vendor to a healthcare facility or the healthcare fraternity. It's about being knowledge partners, improve the standard of care, improve the knowledge of people, make them understand why they are using a product, how they should use a product, and when they should use the product. It's important that we do not spend money just to do something. It's about understanding what is required and then do it in the right way. So we would, with this whole collaboration with NQOCN, we just want to bring in this whole quality culture at the forefront and engage with people, like-minded people, to ensure that we bring our bit to it and help improve the whole environment. So thank you once again, Dr. Datta, for giving us this opportunity. It's, like I said, it's a privilege. And I'm sure that we will also learn in this whole process and then help generate the awareness about quality across the whole healthcare fraternity. Thank you. Really appreciate it.
Thank you so much, Rajiv sir. We now have some quick questions for Dr. Vikram and team. We have a question from Dr. Ankur Sudan. Ankur, please unmute yourself. Your question, please.
Hi, thank you, Vikram. So I'm Ankur. I'm a consultant in quality improvement and a founding member of NQOCN. So at NQOCN, a major stream of our work has been around hypothermia. And hypothermia among sick and small newborns, and also hypothermia among all newborns immediately after birth. So I would just want to know if there are specific products or solutions beyond just a product that caters to that particular problem point.
Right, sir. Dr. Thank you for the question. So the straight answer would be yes. We do have, but let me also highlight the point that the solutions that we have been focusing mainly at this point on the perioperative hypothermia. But yes, we definitely can look at expanding the indication, and we have a range of solutions for neonates and the pediatrics as well. So we will be able to work together to identify, what's required first, and then probably we'll be able to better, suit our solutions to get to the desired outcome. So the simple and straight answer, Dr. Ankur, is yes. But if we can work together in trying to identify what is the root problem that we are trying to address, we'll be able to better showcase and share the solutions that we have and usage point of view that we can work together.
Thank you so much, Dr. Vikram. We have next question from Dr. Prabha, then Dr. Surekha, and then finally Dr. Kedar. So Dr. Prabha, can you just put your question? Unmute yourself, please.
I think Dr.
Yes, just a moment. I'm handling this.
Yes, sir. Good evening, sir. I'm Dr. Prabha. I work as consultant gynecologist at Bhagwan Mahavir Hospital, and I'm a national mentor for quality improvement for Government of India's Lakshya program also, sir. So technical competency in managing CSSD is one of the indicator of Government of India's Lakshya program for maternity OT assessment also, sir. So it would be very helpful if some training program for OT technicians can be organized, as OT technicians of government hospitals especially, they don't get much chance to attend any such training programs. So sir, this is my suggestion and a request to you, sir.
Dr. Guduri,
Dr.
any takes on
Prabha,
that?
sorry, Dr. Datta.
Yeah.
Yeah, I was saying, Dr. Prabha, thank you so much for, for those kind words. I think, you echoed our concerns, and we will be very, very happy to join hands and be able to share that knowledge with the OT and the CSS technicians. So definitely, if you can, and we'll reach out to you, or, if you can share your email or contact details, we'll get in touch with you. And we have a lot of online modules to start with already. But if you also require a physical training or a workshop, as the things improve, and if the situation allows us to travel and meet you, we'll definitely be able to support the required.
Thank you, sir. Sir, online training sessions link will also work, sir.
Perfect. So we can start that right away, Dr. Prabhas. We just require the details.
So Dr. Guduri, I think Dr. Prabha Ranjan is a national mentor and she's a part of the COP. So I think for the larger good, we could be collaborating on some common theme areas, which are the areas which the members are raising right now, and they could be all put together either as a common link on your knowledge platform or on the NQOCN COP platform with a link. So that could go directly for all the teams. So Prabha, your point is well noted. I think the office to kindly note Dr. Bani, Dr. Rahul, Dr. Prabha's point. So next I go to Dr. Surekha Taide. So do we have Dr. Surekha Taide? She had a question. Okay, so Dr. Kedar, please go ahead.
Yeah. Good evening, everyone. It was an excellent presentation, and we are also using some of your products. But I would like to know some skin-friendly product as far as newborns are concerned. So all over the world, the neonatologists are worried about the nasal injuries from non-invasive respiratory supports, which is increasingly being used nowadays. So do you have any products related to prevention or treatment for the nasal injuries?
Yes, sir.
That I would like to
so we do have solutions that can be safely used on the neonate and the pediatric population. We have a product called Cavalon nose sting barrier film. This one is a non-alcoholic nose sting preparation which protects or creates kind of a barrier film on the skin and protects this neonatal skin from friction, body fluids. And so, yes, this can be used on the patients. And in addition to that, our skin-friendly solution would also encompass a silicone-based tape, which is a very, very friendly adhesive that can be used on the neonates and the pediatrics. In addition to that, we have non-adhesive solutions called the cohesive bandages. We have technologies on the IV solutions front and others which are specially catered for fragile skin. So to better help you select and choose the right product, if you can choose your contact details, Dr. Keda, we will be able to showcase all the solutions that we have and probably look at the root problem that you are trying to address, and we'll be able to better give you the solution.
Sure. Thank you very much.
Thank you, Dr. Vikram. Yeah, Praveen, please go ahead.
Hi, my question is regarding NQOCN partnership with 3M. So we're looking at, rather than the product focused, the patient safety and how the journey is going to be. For example, as partners, are people working on the ground, we identify patient safety issue and we want improvement in the quality of the care there. So how do we take that journey in terms of there are many products, there are many solutions available, but around the country, the challenge that we see is the implementation side of it. That's where the QI comes in. Do we have any plan towards where do we start and how do we kind of a progress, or that is something that I'm sure Vikram also might be thinking that will be coming up with some sort of SOP for that?
Yes, sir. Dr. Praveen, thank you so much for the question. Now, you rightly said, it's more about the process, and we also do not want to link it with the products, as Rajiv also has emphasized. Our education is more about creating the best practices and not merely, linking it with a solution or a product. So to start with, yes, there it is. We have just started the journey, so there will be a lot of areas of opportunities that we can work together. But definitely two areas that definitely come to our mind that we can start looking right away is one is Normothermia project, because that is something which is a common link between NQOCN and 3M, and I'm pretty sure that there could be a lot of value addition from the technology of 3M and the competency of the NQOCN. If we can together work, that will be a great platform. Secondly, if we can also look at the perioperative process in a childbirth, right? If that is a special segment that we can look at, the gyne and obstetrics, because that is probably the most common surgery that happens in the country, right? So if we are able to look at that particular section of surgeries and together work, that probably will either be other area of interest that I can think right away. But again, I'll leave it to Dr. Datta to guide us on this, how we want to take it forward.
Thank you. I would be responding in the end, just 3 more minutes for this session, if Vikram will allow me, and Rajiv sir also. I would be ending it at close to 7 because I had a commitment of 1 hour from Vikram and his team. So I wouldn't be extending that. Otherwise, NQOCN meetings normally offshoot, but we will be ending in next couple of minutes. So we have a question from Neetu Taneja and then Harish Pemde. Yeah, Neetu, please go ahead. Please unmute yourself. So, yeah, Neetu, please go ahead. Otherwise, we'll request Dr. Harish to please go ahead. Dr. Harish? Yeah.
Okay, thank you. Good evening to all. And good evening to Mr. Vikram from 3M. I'm sorry I missed your presentation, but I'm listening to this discussion. And very interesting one is related to hypothermia. As a clinician, I want some device which can be put on the body of the child, especially newborn baby or young infant, malnourished children or very sick children, which can alert me on the temperature variation, whether this is hypothermia or hypothermia, and glucose variation, if it is hypoglycemia or not. If I can find some of this device which can give a signal on my mobile phone connected with Bluetooth or Wi-Fi or something, that this can be a great life-saving thing for sick children, because very commonly we find hypothermia and hypoglycemia kills the children in the ward, especially during the winter times and early morning hours. This is a very, very typical thing which happen to malnourished children, to young infants, and even in newborns. So are you considering, or are you aware of some device? 3 years ago, there was some company which was coming out of some similar device, but it couldn't become so popular. Your comments, and if it is not there, then my request that we can work for it.
Thank you, Dr. Harish. I can tell the good news is that is available and we are having that device. But let me answer that in 2 different sets. You have said one is normothermia measurement, another one is a hypoglycemia measurement. Now, unfortunately, the device that we have can only measure the hypothermia sensor, but it is not the hypoglycemia sensor. So this is a non-invasive, as we were talking, and it can be placed on the forehead of the neonate. And it continuously measures the core body temperature, and it measures the core body, not the surface temperature. So you definitely get the actual definition for the hypothermia. So that's a non-invasive, and it gives you a continuous reading so that you can be alerted whenever there is a drop in the temperature than the desired levels, or also hypothermia as you are referring to. So short answer, yes, we have a solution for measuring the hypothermia or hypothermia with a non-invasive continuous device. But I'm sorry, at this point, we don't have a device which can sense the hypoglycemia.
No, such devices, we need to monitor someone, human being has to see those devices. I am referring to something which crosses that limit, gives a signal on some mobile device or some kind of beep or beep somewhere. That will be very, very important, because early morning time, mother is sleeping, doctors, nurses are also sleeping. That is the time where most such things happen. So it can there be a marriage of two technologies, and such signals can be generated from this device?
Point well noted, Dr. Harish. I will, I don't have a right away answer to that, but let me check if that technology can be married with an existing device. And if that can be done. But let me get back to you soon.
Thank you.
So thank you so much, Harish, for that innovative R&D idea to the 3M team in India. I'm sure they will come up with something very soon. So we have the last question from Dr. Bangal. Dr. Bangal is the professor and head of obstetrics and gynecology at Pravara in Maharashtra. Sir.
Thanks to NQOCN for this initiative of meeting partners. It was a great beginning with very important area of concern, that is infection control and patient safety. The talk has generated new ideas to work on in the area of QI. I would like to know more about if a particular institution wants to have some collaboration with 3M in different areas, health education or even the products range, whom to contact and how to develop that communication.
So you can write it to any of us here, Ankush Jain or myself, or I'll take the liberty to take a name of Dr. Rajiv as well, that you can reach out to us. But if you need any contact of us, if Dr. Datta can help in collaborating that will be great. But any of us, if you can reach us, sir, and then we will definitely make an initiative to contact you and see the opportunity to collaborate further.
Okay, thank you.
So thank you so much, sir. So I think the 3M team here, Rajiv sir, Vikram, Ankush, I think you must have seen the basic aim of this platform, which is facilitated by WHO South Asia, is basically to bring together the partners. And there's so many, minds here who would like to know more about how to bring about, quality in the level of infection control practices, wound management, etc. And also collaborate in their respective settings. So this is the basic, motive of the community of practice. And I'm very happy today. And I'm saying Dr. Rajesh Mehta is also here that it has started to move in that direction with the partners and the end users and the champions, connecting to drive towards a quality improvement revolution in India. So very quickly, I would just like to give the take. The one is that NQOCN will be the point of contact for any partner who is a member of the community of practice to take forward any collaborative interventions with 3M. We will facilitate your connections to the 3M India team and help you in connecting and forging alliances there in your respective setups. So don't worry, you can write directly to NQOCN office. We will connect you to Ankush, Dr. Vikram and Rajiv sir. So this is the first part of the question. Second is regarding the most important part is, I think, our initial discussions during the partnerships focused around normothermia. So Dr. Vikram, we would be very keen to, take this forward and also look at peri-operative hypothermia. From my own experience in Kalavati Saran Children's Hospital, Lady Hardinge Medical College, I work in the neonatal ICU. Large number of babies, when they return from the operation room, they are hypothermic, and invariably the clinical outcome, deteriorates when the baby arrives hypothermic, despite the best intentions of the operating team and the neonatology team, which is accompanying them. So this is one unmet need, even in Delhi in warm months. So I think we can start a collaborative of normothermia and perioperative hypothermia. I reiterate that we need to very quickly get down as NQOCN and 3M partnership initiatives to launch a collaborative in the country with the support of Dr. Rajesh Mehta and his team. I'm sure it will not be difficult for the COP to take it forward into some meaningful collaborative and quick results over 3 to 6 months. So that is the first and the priority number one I've written in my register. The second most important priority for us would be to talk about the 3M Healthcare Academy. And like Dr. Rajesh Mehta told you, we are our other partners, the Infosys team, the ASTAR. We are already in the process of advanced developments of some online quality improvement courses. And we would be also looking towards the 3M Health Academy. And if with the permission of WHO later on, we develop some more courses, we could probably think about, not only providing a link on the COP website to access the 3M Healthcare Academy like we were initially talking, but also host and put it to you to take it up to the larger global audience from the Indian experience. And also most of our partners who are here right now and our members, they're very renowned and they've each got a success story which is far better than the stories which got published in BMJ. And I think that needs to be showcased to the world. Again, coming to the important focus areas which NQOCN network has still not explored is, one is, I was really enthused, and I think many of my members said, is infusion therapy best practices. One of my DM students has just finished his DM neonatology dissertation on CLAPSI bundle approaches, and I think Dr. Kedar has also done some work on CLAPSI bundle approaches. So this is a checklist-based approach, and it's coming up for publication. So I think we could see how your infusion therapy best practices for neonatology could be aligned to the CLAPSI bundle approach policies, which we are trying to manage using the point of care quality improvement approach. Again, we could launch a collaborative on that. Second, the third most important is the surgical site infection. That becomes one of the Lakshya deliverables also for Government of India. So I think as technical partners to Government of India for Lakshya, NQOCN would be very, very happy to collaborate and learn more from your team and your experience on surgical site infection, because that becomes one of the deliverables for Government of India certification of NQOCN also. And lastly, the wound healing QI. I think that is something which is very, very important for our obstetric teams, Dr. Bangal, Dr. Prabha, Dr. Anupa, all of them who are here, and also my nursing teams who are here. I think it's very, very important that the wound healing quality improvement. So these are some diverse areas which NQOCN has still not explored, and I'm sure today with the take from all of you, we are more enlightened. So with this, I think I will be writing very quickly, and we look forward to, with Rajiv sir's permission, we look forward to a follow-up of this session, maybe over the next quarter, and we will be maintaining, regular contact. And we would request you to, think about methodology to grant access to the 3M Healthcare Academy on the COP platform, Rajiv sir. So that is one request straight away. And then we can work forward towards, better collaboratives. And I can, be leading my team to be collaborating with Dr. Vikram and taking this forward. So any final words, Rajiv sir, from you?
Dr. Tata, thank you for the whole session today. I really, the Healthcare Academy platform is a very value-added services which we provide. Let me evaluate the options of providing the whole platform on NQOCN platform. Let me evaluate the options and come back to you. So I don't want to commit something right now without understanding how the whole system will work, but I will surely come back to you and confirm how we can do that, how we can move forward. And I have written down the same points, the 5 points what you talked about. Rather than spreading ourselves thin, we will prioritize 1 or 2, start working on that, and then we will start engaging with you on the balance 3 also. So we will come back to you and start working on that. For all the other people on the call, yes, Dr. Datta and NQOCN will become the key facilitators for our whole engagement. If there's anything where you want our help or information or any support in terms of quality improvement processes or engaging on certain improvements in your facilities, please do send the information to Dr. Datta and we will take it forward from there. So thank you for the session today. Thanks.
Thank you so much, sir. Thank you so much, and wishing all of you a very happy evening again. Stay safe, and I would say we look forward to several sessions again, and would invite the 3M team to also join in the future sessions which we have with the other partners, sir. It's basically the main aim of the community of practice is to know each other and connect and spread the good word around. Thank you so much.
Thank you.